And you may have heard that Captain Sully Sullenberger, the pilot who saved 155 lives on the Hudson, is now opening up about his battle now with Alzheimer's disease, announcing yesterday that he has been diagnosed. So joining us this morning is Novant Health neurologist Dr. Robert Wiggins, breaking down what this means for them, certainly, and certainly a topic of conversation as we shed some light on just this awful disease. Doctor, thanks for joining us this morning.
Thanks for having me.
Well, with this household name announcing, that he has Alzheimer's disease, although he is in the early stages. For viewers who don't know, what does an early stage Alzheimer's diagnosis actually look like day to day?
Yeah, so Alzheimer's disease at its earliest stages really looks like we could say some forgetfulness. Now, the important thing is that's not just, say, forgetting where you put your keys. That's more profound forgetfulness, like things such as repeating yourself with questions, not remembering what you maybe had for breakfast that morning, more and more trouble remembering some of the day-to-day things. That really becomes kind of a level where it's impacting your daily life. So not just forgetting the keys or forgetting a name or that name of the band. It's really starting to be more profound, and they may start to notice some other things too, where there may be some issues with independent decision making, where they may need more help with doing the taxes or finances, that kind of a thing. Alzheimer's disease is pretty profound, and it can be pretty destructive for patients and also the people that care for them.
Yeah, certainly. With early stage Alzheimer's, how is that diagnosed? Besides, the things that you mentioned, but how is that process changing for doctors, for neurology, neurologists, I should say, when you speak to a patient?
Well, Jane, honestly, one of the most exciting things is the way that we're diagnosing dementia, particularly Alzheimer's disease, is radically changing. So it used to honestly be really this process of, I've asked you a few questions and it sounds like you have dementia, it sounds like you have Alzheimer's disease, but there's actually blood tests now that don't diagnose Alzheimer's disease, but can really start to look for some of what we call the biomarkers, effectively saying, hey, your blood is actually showing markers of a process like Alzheimer's disease. And so when I'm diagnosing Alzheimer's disease, I really try to take a really good history, make sure I understand what is going on in the patient's life. Second, trying to make sure that things like medications, low vitamin levels, other stressors, depression, anxiety are not clouding the picture. We'll always get a picture of the brain and then do a cognitive test. That's really an objective way to try to put a number on someone's impairment. And then, like I said, Jane, we'll typically these days go towards some of those blood tests, really just confirm that is actually what's going on.
By the time they see you, though, I mean, they've gone with their primary and had some discussions, and so it's elevated to a point where they need to see and actually talk about what might be going on in their brain, though, right?
Sure. That's the hope. Yeah, I typically recommend that, my friends, family, if they're having cognitive concerns, like you're saying, go to their primary care doctor first. One of the major causes of memory issues in America is what I was saying, is medication side effects, depression, anxiety. It's very likely that those things are at least clouding the picture, right? I know that whenever I take medication sometimes, right, I might not be quite as sharp as I was. And so it's really a good idea to try to eliminate those medical causes. And then if they do require the help of a neurologist, we're here to help out and really try to use the most advanced, most forward-thinking ways of diagnosing this, and then also treating this if this really is what's going on.
Let's talk about some of the symptoms and who this affects, because Sullenberger said that, or his doctor said that this disease spares no age group, no gender. I mean, who is actually at risk?
To be honest with you, we're all at risk to an extent. We know that about 7.4 million Americans have Alzheimer's disease. And so we know that the most common, we'll say, risk factor is age. But what I want to emphasize is that does not mean that this is a normal process. Though we have a higher risk as we get older, this is not just a part of aging. And so the people that are most at risk, of course, are the elderly, or you could say people who are more advanced in age. The other thing that we have to remember, though, is that there are other things that increase the risk, right? And so really any ways that we have not taken care of our body, whether that's things like diabetes, blood pressure, cholesterol, any of these cardiovascular or cerebrovascular risk factors can really increase our chances. But the important thing is this, is there are ways that we can try to reduce our risk. So we always joke, an apple a day keeps the doctor away. Well, there's actually a brain health recipe that can help us try to protect our brains for the future and prevent things like dementia.
Oh, yes. Give us the recipe. What is the secret, doctor?
The recipe is made up of 4 things. It's actually recommended by the Alzheimer's Association. The first is cardiovascular exercise, really focusing on trying to be active, not just, walking around in your job, but really focusing on good exercise. That's the first exercise. The second is cognitive exercise. I like to look at that as saying, yeah, sure, crossword puzzles, reading good books, that's all good for you, but really staying engaged with your loved ones, your friends, your family, not just watching TV all day long, really trying to use your brain, challenge your brain, that's important. The last 2 is 1, making sure that you're following with a primary care doctor to make sure all your blood work is checked. That's really focusing on things like making sure that you have, if you have diabetes, it's treated, cholesterol, blood pressure, all those things are really well, addressed. And then the 4th, perhaps the most challenging but very impactful, is actually nutrition. So what I would recommend to myself, to you, to everyone is something called the MIND diet. We can go look up the MIND diet, but it really focuses on 10 ingredients that we can increase in our diet, 5 that we can take away, and the most important that I would recommend would be really focusing on dark green leafy vegetables. So that's spinach, that's kale, that kind of a thing. We really have good evidence that that's really healthy for the brain.
All right. So for Sullenberger, who says he doesn't want to look backward and just keep on doing his thing and slowing down the progression, what does realistic care look like? What does that lifestyle change look like? And can you slow down the progression of Alzheimer's disease? And by how much?
Yeah, to be honest with you, 5 years ago we would have said no, you cannot, outside of some of these lifestyle modifications. But today we actually think you can. So with those lifestyle modifications, as well as new medications, new infusion therapies, we think that you can actually slow down the progression of Alzheimer's disease. You asked by how much. We typically think that with these medications, over about 18 months, we can reduce the progression by about 30%. Now, that's not stopping the progression, that's slowing the progression down. But think about it this way, that's not just numbers, on a piece of paper. That's more high school graduations that people can attend. That's more pickleball that people can play. That's more time, more good time, really good quality of life. And that's what we're really focusing on here.
Yeah, I mean, he credits his wife, his partner, his loved ones. What should family members know about supporting a loved one with dementia or Alzheimer's disease?
Yeah, well, if I could say this, we talked about the 7 million Americans. There's like 14 million Americans providing unpaid care for people who have Alzheimer's disease. It is a huge burden in our country and in our world. The thing that I would recommend to people who love those who have things like Alzheimer's disease is this: really get a good team. That team is made up of not just your doctor, not just nurses, but your friends, your family, maybe your attorney or someone in the community to really understand what to expect going forward. As Alzheimer's disease progresses, we know that the memory challenges become more significant, more severe. Patients can even start having trouble getting lost when they're driving, when they're walking around. That's how I knew that my grandfather had Alzheimer's disease. He was raking on the wrong side of the yard. It can be very impactful, but here's the thing that I would really say, Jane, is that there is hope. There is advancement. I'm very excited about the future, not only for my patients, but for all people that have Alzheimer's disease. I do think that the cure is in sight, and I'm really hopeful that day hopefully will come very soon.
All right. I think that's what we want to hear as well. And so I'm going to leave it with a positive note of optimism and hope for those who have to deal or know somebody with Alzheimer's or Alzheimer's disease or any form of dementia. Dr. Robert Wiggins from Novant Health, appreciate your time this morning. Thank you so much.
Absolutely. Have a good one.
You too.